Hi there, I'm in clinic this morning and one of my colleagues is going to do some botulinum toxin treatment for me later. So I'm just going to plan out what areas I'd like to have treated and what sort of doses I have in mind. In Ireland, botulinum toxin is prescription only medicine, so you have to see a doctor or dentist to assess your suitability, and then they have to administer the treatment themselves. And so regulations vary in different countries. Because I'm 58, I want my results to look really natural and subtle. I don't want things to look too frozen or look too obvious. And I accept that over time I'm picking up lines and wrinkles, I'm accumulating sun damage, and a lot of that was in childhood when we really didn't have access to sunscreen products. So things are so much better nowadays. So when I look, I've got some movement on my forehead. That's okay. I'd like to reduce that a little bit. And everybody's got their own different pattern because we all have different strengths of muscles and different muscle fibers. And in general, botulinum toxin is dose dependent. So the more you put in, the stronger it's going to be. But if I put in too strong a dose here on a patient, I will drop their brows. So when I'm being treated by my colleague later, I really want that dose to be light, particularly on the forehead where we need our frontalis movement to lift. Over time, the lateral brows particularly get heavy and they start to get a bit hooded, and your body's natural response is to lift up like this so we can see danger coming at us from different angles. Now that's not an attractive look, and that can actually be caused by misplacing the toxin, and we call that a Mephisto or a Spock look. So I don't want that, obviously. So when I'm being treated, I want to just soften the lines here so that there's a little bit of reduction of movement of these lateral fibers of frontalis. I want to preserve some lift so I can still make expressions. And because most of us are asymmetrical, I am also asymmetrical, and my right brow is lower and my right hairline is a little bit lower as well. And I can pencil that in if I want to. I've had some adjustment of my brow height using the tattooing pigment, which has been really good. But also I can have a small dose here at the tail of the brow to stop the lateral upper fibers of that muscle orbicularis oculi from pulling downwards and inwards. So there's lots of little tricks that we can do to make the treatment bespoke and make it really suitable for that person. Again, mostly middle-aged women like myself, we really need our frontalis to lift. So often people will come into me and say, oh, I want you to get rid of all these lines. I want you to lift my brows. I want to get rid of everything here. And it's a wish list, and we take everyone's concerns into mind. But there's certain things you just physically can't do. So what happens with a muscle is it's always going to pull back towards its origin. It's never going to push. So if we want to reduce the effect of one muscle, we'll often treat that muscle to weaken it. Or if we want a lift in that area, we'll weaken the opposing muscle or the muscle that's pulling against it, a bit like a tug of war. So when I frown, I like to have some movement here, so I don't want to get rid of that completely, but I might have a small dose here in procerus, and that muscle pulls the brows down and inwards and makes us look angry. And then we've got two muscles here called corrugators, and it's a bit like a snail or a slug. It's thicker here and it thins out a little bit to the tail there. So I can have a small dose there and there. There's a little tiny muscle here called depressor supercilii, and that pulls in the brow medially here at the center. And you can treat that separately, or generally with an adequate dose in procerus, we'll reach those little muscles as well. Because I have a high forehead here and I'm asymmetrical, I don't want a big dose, and actually I'm quite smooth up here, which is interesting. So the areas I want a little bit of reduction in movement is just here. And then I've got a little bit of movement there. I also have a small bit up here and a little bit there. So anywhere I have toxin placed, it'll spread a little bit, but I don't want that to spread too far. You know, I'm 58. I expect these lines. I don't always like them all, but I don't take them away completely because I want to be able to express and show surprise and show disappointment and all of those emotions. So when I look and I make expressions, we've got the difference between static lines, which are there at rest, and dynamic lines on movement. And my pattern is a little bit different on both sides. So when I'm being treated, I'll have a little bit of treatment here and I'll have a little bit of treatment here. So those are the areas. If that toxin is brought in too far, it can affect the zygomatic major muscle, which is connected to the zygomatic bone here and comes down to the corner of the mouth here. So we don't want to bring the toxin too far in or too low. So these kind of lines, absolutely not suitable for treatment with toxin, because that skin is lax, and if that's called a snap test, and if that bounced back really quickly, I could potentially, for some patients, put a tiny bit of toxin there to deliberately open up their eye a little bit, but for me, I would be totally unsuitable for that. On this side, again, I'm looking at the lines that are coming up here, and my toxin placement will be a little different on this side. In some people, you can treat these little bunny lines. I don't really bother having mine treated. They're not bad, but if they got very obvious, I could have those treated. And it's a little muscle nasalis that goes across the bridge of the nose and stretches out. And in some people, it's very obvious, or if you treat the other areas and they go a bit quieter, this can stand out. So it's optional to have that treated. The other areas that can be treated are little here at the base of the nose, at the columella. So over time, the nose hole or aperture gets bigger and the nose tends to drop and we lose fat on the nose and it can look a bit more hooked or a bit bony. So there's a little muscle here called depressor nasi septi, and you can have a little bit of toxin there, and essentially it stops that pulling down and you get a little perk of the nose. I don't think I need that really, but it's something I could do. Where I like to have toxin occasionally is around the border of the mouth. So again, the eyes and the mouth are moving all the time. I'm making lots of expression and we can get lines there. So if the lines are obvious, we can use toxin. If they're very etched in and very pursed like this, at rest, toxin's not going to fully correct them, and we may go in with an incredibly soft, runny hyaluronic acid product coming in from outside the corners of the mouth and fanning out a little bit. But if that support isn't bad and the lines are not bad, you can use tiny little bits of toxin close to the edge of the lip to just turn it out a little bit and give a little more pink lip and a little bit more show of the lip. And you can do tiny bits at the apex or the top of the cupid's bow to flip that out a little bit, and we call that a lip flip. One of the other areas that's common to treat is this area here, depressor anguli oris, because that muscle pulls down the corner of the mouth like this and this. And think of a kid drawing an upside down smile, they'll draw that shape. So if I have these treated and they don't pull down as much, the lifting muscles or elevators can give a nice lift, and it's quite subtle. In some people, the chin is very pebbly, and we call that a pebble chin or a cobblestone chin, and you can treat that with toxin. And we're treating mentalis, but we don't want to treat a muscle here called depressor labii inferioris, or we distort the smile. So we tend to do tiny doses and sometimes just very superficially to treat the top of that muscle, or we can go deeper if we need to, if the muscle is strong deeply. So those are the areas that I am going to have done today. Small bit here, a little bit on the forehead, a little bit on the crow's feet lines. My mouth is currently okay. I'm not going to have that treated today, but I definitely always like to have a little bit put in the DAO, depressor anguli oris. What I found over lockdown, I was back in GP work and I was wearing masks all the time, and just that kind of physical act of clenching a little bit to keep the mask on, my masseter muscles here at the side, which is where my fingers are, got quite strong and bulky, and they were giving me some dental pain and a bit of tension headache, and a colleague treated me with a little bit of toxin there, and that made a really nice difference. But because we're not wearing masks currently, that muscle is actually settled down. Other areas we might treat sometimes is the neck, in the platysma muscle there. It's not, it's not looking great at the moment, but I don't know, again, I don't want to look like I'm overdone or over-treated. So I'll just keep an eye on that. And if those bands get very strong, which is from the platysma muscles here in the neck, I could have those treated as well. Over time, I can see things are sagging a little bit, but what I don't want to do is get too full and giant cheeks, and then have full cheeks, frozen forehead, and a saggy lower face. So we want all of these thirds to match. So the key for me is to have a subtle treatment here, not overdo the cheeks so they're not too big, and yes, there's still a bit of lift there, but it's fine for the moment. And then, yes, I could have that improved, but again, I don't want to be, too full and have too many treatments. So those are the kind of things I'm thinking of later. I'll have the opinion from my colleague as well. It's always great to have a different set of eyes looking at your face, because over time we can get sometimes a little bit of perception drift, where we start at one place and we have a little treatment and then another little bit of treatment, and before you know it, we've sort of forgotten where we started. So it's always nice to have that grounding from staff or friends and myself as well, with an artistic and objective eye to say, listen, enough is enough, and keep the treatment subtle. So I'll come back shortly when I have my treatment and show you the results. Take care. Bye.